Check, 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 check. Okay, there we go. Okay, once you guys have finished, well, we should be about finished, right? Let's go ahead and get into the Menti today. I'm gonna do a quick check-in with you. So remember, on your computer, on your phones, go to menti.com, MENTI. Or you can scan the QR code that will come up. Maybe, oh, I guess it works better if you're plugged in, huh? Oh, wow. Okay, so go ahead and go to menti.com or scan that QR code and enter that number. Thank you. And just like some of you guys are already doing, once you've entered the Menti, go ahead and just give me some sort of reaction emoji so I know that you're in. No, you're not. You entered somebody else's Menti. It'd be kind of fun to see what the questions are.
You just put in 1 through 8 and it brought up like coffee or tea. I was getting ready to answer like, what?
Oh, that's fun.
Oh yeah, I was just on 1.
All right, so as we're starting, a couple things I want to do today. Oh, gotta turn this on. Is I want to do a little check-in. Maybe. So this is kind of like the KWL, but I want you to rank your pre-existing knowledge. Where do you feel like you fall on this scale of like your pre-existing knowledge? Do you feel pretty good? You don't know anything, you know a little bit.
Sorry, what's that again?
What we're covering today. Okay, so we have kind of a broad answers here. Nobody feels like they know everything. That's good. One person has no knowledge. That's probably not so good. All right. So in looking at coming to class, how prepared do you feel? Do you feel like you're prepared to interact with this lesson today with like reading a chapter, doing this assignment, being ready to participate? Where do you feel like you fall on that scale? All right, so everybody's, we're averaging out to be in the middle, right? So we're not maybe just like fully here, we are ready to go, but we're also not just completely clueless either. So that's okay. I feel like that's a pretty good place to start. Bless you. So today we're going to start with developmental considerations. That's chapter 14. That's going to be our Menti, what we're in right now. Then we're gonna have a break and we're gonna do some classroom work together, talking about care settings. So once we come back from the break, I'll explain how that's gonna work. And you guys actually are gonna do some of the talking, which is very exciting. I like to have the class break up and work a lot together. And actually like to have people talk to each other and then to the rest of the class. A lot of people say they have a big fear of public speaking. They could never talk to a group of people. You're in the wrong profession then, because every nurse is gonna have to talk to a group of people, even if you're like, no, I just have my patients. Well, the patient's gonna have a family, and they're gonna be there as a group, and you're gonna have to educate them and talk to them and teach them. There's gonna be all kinds of scenarios where you have to talk to a group of people, maybe not this big, but you've got to start getting used to talking to other people once you don't know, and this is a safe place to do it, right? Because we are all, like in the last Thursday with Amanda, we're all gonna be treating each other with respect, right? Like, what were some of your guys' values that you talked about as a class? What do you want your legacy to be?
Communication.
Communication, what was that? Supportive. Yeah, all those things that you guys talked about, what you guys want your class to look like. This is where we get to play out those characteristics. That's where we get to be supportive. We get to be encouraging. We get to be accepting. If somebody makes a mistake, we're gonna be like, hey, that's okay. We all make mistakes. Let's keep going. I'm probably gonna spell something wrong on the board this year. I'm a terrible speller. I know it. I accept it. And guess what I do? I ask for help. There's gonna be times where I go, guys, I can't remember how to spell protein. Does the E or the I come first? I never can remember. So I'm gonna ask for help because you guys are gonna be a resource for me. And that's what we're gonna do. We're gonna look for each other for resources, for help, for support and encouragement. Right? Okay. Moving forward, these are our learning outcomes for today. We're going to talk about Eric's stages of development, which we probably already learned. Well, you're good. Probably learned about Erickson's and psychology. We're going to talk a little bit more, especially when we're talking about medical stuff. We're going to talk about the effects of chronic illness, special needs that caregivers have, so not just the patients, but the ones that are giving care for them. Explain health promotion methods, assisted planning nursing interventions for somebody who's chronically ill. The concepts. So different from kind of the objectives, these are just the overall concepts we're going to be covering. So we've got, what is caring? What does that look like? What is family? Growth and development, health promotion, safety, sense of self, and then reproduction and sexuality. So health, wellness, and illness. So that's all part of the spectrum that we have, right? We might walk in today and we might be feeling really healthy. You might have a headache or a stomach ache, or you're just really tired. And you might be feeling maybe not so much on that healthy part of the spectrum, a little bit unhealthy. But it's ever changing. And when we have an illness, that's an imbalance of something with our health. There's something that's not right, but hopefully as part of our nursing care, we're going to help to correct that balance. So first question, what is the LPN's role to help patients achieve a higher wellness level? If we're trying to move them to that higher, healthier parts of the imbalance, select all that apply. And then excuse me. All right, you guys did fantastic. So yes, all but number 4 was correct. So we do want to make sure that they have a safe environment or that they can adapt to the environment. What may be something that we do for people to help them adapt to the environment?
We have to educate them. Let's go.
And educate them.
Orient them to the surroundings.
The surroundings, yeah. Maybe we give them things like in their bathtub, I'm gonna give them a shower hold, for example, right? Because that environment might not be safe for them because they might not have great balance and it's a slippery environment. But I'm gonna help them adapt by giving another safety mechanism for them. What about, well, reinforcing teaching of healthcare information? That reinforcing is really important. Just like you guys hopefully all read the chapter. Do you remember everything from this?
No, right.
No, we need reinforcement. You
Right.
might go to your patients and you might tell them, hey, I'm gonna give you this call light. I want you to call me. Do you need anything? Don't get up don't get to the bathroom without calling me. Are they gonna listen to that?
No.
Are they gonna remember that?
No.
Oh, they need lots of reinforcement. If somebody's gonna go home, let's say after having a surgery, they've got so much going through their head. Are they gonna remember if you tell them one time all that they need to do for when they go home from surgery?
No.
Oh, they need lots and lots of reinforcement and reminders. We want to perform some healthcare interventions. We're talking about that a little bit later. And then we'll evaluate their plan and progress towards their goal, right? So we're gonna look and say, okay, did that shower handle help them? Did they fall? No. Was it because maybe that shower handle helped them? Maybe they still were pretty slippery, right? Maybe they really had a hard time. Maybe we need to evaluate that and say, I think they might need a shower chair, right? Something they can sit in so they don't have to just be standing up, holding on to that bar the whole time. All right, so we're gonna mobilize our resources for these patients. We talked like getting them what they need. We're gonna provide that safe equipment. We're gonna teach them. We're gonna perform those interventions. We're also gonna anticipate problems, right? We know that shower's slippery, so we're gonna go ahead and get that shower bar or a chair in there before they get into the shower. We don't want to be reactive to their problems. We want to be proactive and think through what might this patient encounter. So how can I help them before they have a problem? And then we're going to evaluate, see how it goes. So now we're going to go into Erickson's developmental stages. You guys remember this from psychology? Yeah. It's always a little bit, where do people land, where do they not land? But it talks about the development of a person. And each person, it really is about that self and their trust in their self and trust in others. And each stage you have to complete before you move to the next stage. So it's not like I can just skip this trust and mistrust and go right on to the next stage. I have to get through that stage before I can go to the next. So we're going to talk about young adulthood, 18 to 40. And then it's intimacy versus isolation. So this is often a time when people are getting married, right? Divorced possibly, figuring out like separating from their parents. So it's a lot about that relationships. Are they intimate with others? Do they have those close connections or are they isolated? 40 to 65, generativity versus stagnation. Some people talk about having midlife crisis. Where am I? What am I doing? What is my value and my worth? They're trying to figure out, do I have purpose? And then late adulthood, integrity versus despair. Is it it? Is this it? This is all that life is. Or do I have hope? Do I look back at my life and think, no, this has been a good thing? So if we're going to plan care for a patient, which do we identify as a developmental risk for older adults? So what would be concerned that they maybe would not reach?
Task.
Hmm?
Oh, you said risk. They may not reach.
Let me read this again. I care for a patient. Which of these does the nurse identify as a developmental task? Oh, where do we want them to reach? Yeah. I didn't say that very well at first. Please forgive me. Yeah, so you guys are great. It is the integrity versus despair, right? The older adult, that's the one we were just talking about. That's the Erickson's level that we want them to meet, to get to. So last week I brought up the nursing practice analysis. The NCSBN is they're the people that kind of look through and help with the NCLEX. And they kind of tell us, hey, these are the things they actually, you guys might even be one of the people they monitor. They send out these things and they say, okay, you've been working as a year as an LPN. Tell me how many of these skills did you use? How many were the most important for you? What about all of this? Where are you working? They find all this stuff out and then they put it together and say, okay, this is where our LPNs across the country, this is what they're doing. This is the skills they're providing, and this is the knowledge they need to know. And they actually will adjust the NCLEX based on that because they're like, hey, this is our current environment. This is what we need to make sure that our nurses are skilled at and able to function well. So one of the practice tips is that we want our LPNs to meet the needs of adult clients from 18 to 64. Okay, so they're saying, hey, that's a really broad range. That's a pretty overall, that's obvious one, but there's gonna be some other practice tips I'm gonna bring up as well. That they'll say,
I
yeah,
have a question, how did they determine what would cause health concerns like stage?
oh, that's a great question. Probably more suited for a psychologist.
Oh,
Yeah, I think they kind of just took different ages and what are the biggest as far as the self and the self interacting with others. What are the big challenges or what are the big things they need to work through to be able to progress forward in life? As far as how they got there,
yeah,
that's a little bit more cerebral, like
okay.
I don't know. That's a good question. If you find out like where Erickson like decided to do everything, feel free to come and share at the class next time. Yeah. Sorry, I focus more on the nursing part of it and less on the psychology part of it. I have a sister who is a psychologist. Maybe I'll ask her. Like, why did Erickson get really into this? Okay, so now we're gonna go into some adult health concerns, right? So just to remind you guys, MedSurg, we're talking about MedSurg. We might talk a little bit about children, but the primary focus is on adult health concerns. When you guys have your peds class, I think that's next term, you're gonna learn more about pediatric concerns, their development, things like this. We're focusing on the adult medical concerns. So lifestyle choices are gonna affect their risk. What are some lifestyle choices that might affect somebody physically? Oh man, they're all like, somebody's up here. I gotta read myself. So in young adulthood, this is where a lot of the lifestyle choices that come into play, right? Drug use, poor nutrition, sun exposure, right? When I was younger, all of my friends went tanning like every day so they could look so brown. And I was like, wow, you're gonna have a lot of wrinkles when you're older and probably cancer. But that was like what was in vogue at the time. And so people wanted to have a lot of sun exposure. Now they have a lot higher risk of having skin cancer. Tobacco use, unsafe sex practices. In middle adulthood, it changes a little bit, some of those practices we look at. And we look at still tobacco use, but also alcohol use. I will say back in young adulthood, we do want to screen for alcohol use, but usually it's select, if not as broad, people who are using or abusing alcohol. It's more in the middle adulthood that we see chronic alcoholism. Okay, sedentary lifestyle, obesity, heart disease, and lung disease. Those are all combined together. They kind of all feed each other. Then we go to later adulthood, and that's where we enter into people that have chronic illness, right? So maybe they had some heart or lung problems that affected them in middle adulthood, but now it's turned into a chronic disease where it really does affect their everyday life. We might even have some things like dementia. We might have some disability, right? Maybe they're diabetic, but did not control or didn't have their diabetes well controlled, and they had to have part of their foot amputated. Right? That's a direct correlation to their disease process. And now they have a disability. They also might have sensory issues. They might fall more often. And we want to look at suicide too. This is a lot about, remember that Erickson stage, the generativity versus stagnation. That's a lot of times people will look at life and think, gosh, I don't know if this is worth it. And they're at high risk of suicide if that's really where their mind is at. And so we want to make sure we're screening those patients for suicide. So practice tip analysis. We want to make sure that we understand what are the stressors that affect the client's care. And I just want to make sure you guys know this doesn't mean that you are personally responsible for fixing your patients or making sure that they are doing health, or they're treating their health and wellness in a way that's correct. Well, what we think is correct. Because ultimately we have to still give our patients choice. We have to understand what are those issues they're facing, and we have to give them the tools and the knowledge they need to become healthy. Unfortunately, there's a lot of people who don't want to use those tools, but we have to accept that because they still have to have choice. We want them to participate in reminiscence therapy. Anybody know what that is?
Remembering?
Yeah, it's remembering, right? Somebody's having a hard time. They're like, man, my life is miserable. Like, what was any of this for? And so reminiscence therapy is just walking our patients down and saying, hey, tell me about where you're from. What's one of your best memories as a kid? You have children. Tell me about that. What were some things you enjoyed from being a parent or your job? Like, let me know, like, how did that go? It's looking back at those positive things reminiscence therapy isn't just for older adults, right? But we could all probably benefit from some reminiscence therapy, thinking back to some positive things in our life. But we also want to help them transition to some expected things like retirement, right? Hopefully, any of us will work until the day we die. Hopefully, we'll be able to retire and do something fun, maybe not fun, but whatever fun is. But that's an expected transition in life that you will retire eventually. And we want to help prepare our patients for that, help them work through those changes. All right, so middle adulthood, going back. What is a nursing care goal for middle adulthood? Select all that apply. Middle adulthood. Okay, some varied responses. All right, so correct answer was to promote positive lifestyle choices, empower patients to make healthy changes, and provide education on vaccines. So reminiscence therapy, that's really the older adulthood is where we focus it. Doesn't mean that that's shouldn't be something we use, but that's the primary. Good question.
What do we identify as a computer they have to help them like move forward?
Yeah. It's a pretty broad term, or like identify confusion. I see what you're saying. But I would say if I was doing this as just a test taking strategy, look at the correct answers. They're going to promote positive lifestyle choices, empower patients to make healthy changes. They're very direct and very specific. Well, this question is not only very short compared to the other ones, but it's very broad in general. It doesn't really tell me a lot to identify confusion. What is that really saying? So if you're looking at not even for content, not even about the question of what it asks, just over test taking strategies, if I look at this, I would probably not pick this one just because it's so short and worded so differently from the other questions. Does that make sense? Amanda, anything to say on test taking strategies regarding that? Right. Yeah, she was just repeating that, if you don't know the answer to a question and you're just trying to say, okay, looking at the question itself and how it's worded, and then looking at the answers, you want to eliminate the things that are most likely not the correct answers first. And if we look at these answers, this answer is a lot shorter and it's worded a lot differently than the other answers. And so in just test taking strategy, most likely that's not the right answer. Right? If you know what the answer is, you're like, okay, I know that it is to identify confusion. Then pick that. But if you're just saying, hey, I don't know what this answer is, and you're just trying to eliminate other options, that's what I would look at. All right, so socialization. Socialization super important in older adults. Why do you guys think socialization is important? Going back to that.
Yeah, make them to help them with the mobility, so they.
Oh, absolutely, right. Yeah, the more socialization they have, the more they're hopefully doing and keeping active.
More of like a purpose.
Oh, I heard two. Say it one more time. Yeah, it helps them engage mentally. What was the other one?
Just kind of purpose.
Gives them purpose, like the Erickson stage, right? Generation versus stagnation. If we are keeping them engaged socially, if we're doing things with them, that helps them to feel like they're more involved in their life, and it helps them, reach that Erickson stage. So a lot of times we want to look at what can they do, right? Because we talked about some of the illness and some of the problems with older adults and their health might be that they are impaired physically. They're not able to do as much. So you're going to see a lot of hobbies that we encourage people, like gardening, hiking depends on your, like, what you say hiking is. A lot of times you'll see older adults that have walking groups, or people that go together to play cards or knitting circles or things like that. We want to, I'm gonna skip a segment, socialize them, because that decreased socialization, it can increase stress. The more alone and the more isolated people are, the more stressful that becomes. The less likely they are to follow those things that we give them for like healthy measures, right? Hey, we really want you to eat, 3 to 5 servings of fruit and vegetables a day. If they're not around anyone, a lot of times you're like, whatever, I'll eat this can of soup and I'm fine. Like we want to keep them around other people. It also, some people do work beyond retirement age or even begin a second career. So some of that is super helpful for them. My grandpa worked till he was very old. And then he got a second job working at McDonald's in the morning. He and my grandma both worked there. My grandma worked the front counter and she was so cute. She had her bright red lipstick on and she had this poofy white hair, and she would work the front counter and take your order. And then my grandpa worked in the back and he would make your eggs for your sandwich. And they did that every morning, Monday through Friday, for years together. And that was their thing that they did. And they had, a big family, lots of kids, but I really think that helped them just to feel like, no, I'm getting up, I am doing, I'm being productive. That was something that was really helpful for them to remain socialized. Here's just a picture of this couple biking. I love this grandma with, look at her little bikes on her shirt. She's so cute. She's cute, but she's into it, right? She's got something that she likes, that's keeping her social, that's helping her feel like, hey, this is good, this is my thing. So we're going to do a little activity here, which you're going to respond on the Menti. You discover a patient crying whose spouse recently died. He says, I have nothing to live for. I have nobody left, and I've outlived all of my friends. What are some actions you could take? You guys, this is really good. I like this. Talking about active listening. Why do they think that? I really like this answer. Sounds like you had a lot of people in your life. Will you tell me about your friends, right? So that's asking them to open up, but it's also acknowledging and hearing what they're saying. Join a club. Let them know that you're here to listen. That's so good. Oh, I really like this. Go to eye level. I think that's something that's really important, especially in nursing. If you think about how the levels can affect how people perceive you. Like right now, there's a bit of a power dynamic just by the fact that I'm standing up and you guys are all sitting down, right? That puts me in a somewhat of a position of power. My position as a teacher, as an educator also does that. But if you think about nursing, so many times our patients are sitting, they're lying down in bed, and the nurse comes in and we're standing up usually, right? It's a power thing. But if we have somebody who's feeling emotional, they're doing something, the very fact of coming over and just coming and being on a level, it kind of feels that it lets them know, hey, I'm not up here. You have me. That can make such a big impact on your patient. In fact, most of the time when I'm talking to my patients, if I can, I try to sit down. Like if I have to go and do a little bit of charting in their room, oh my gosh, first it's nice just to sit down, have a seat, but then you're putting them on their actual horizontal level, which really does a lot for making patients feel like they're feel like they're seen, and that you are willing to come down to them, to see them for who they are. So some of the things the book really likes to point out, sit with the patient, right? Don't just say, oh, I'm sorry, and walk away. Be there. Like physically being a presence can have a big impact. We can ask if they want to speak with a chaplain. Sometimes people want to do that. Sometimes they want to just speak with you. You're the one they opened up to, right? You're the one who they feel safe talking with. We want to inform, so part of a care team, the RN can make a referral to social work. Maybe this patient is also expressing that, they don't have anybody at home. They're lonely. They would like to actually be involved somewhere else. And a social worker can help plan, what are our discharge plans? What are we doing after they're here in this facility? Sitting with the patient, like we said, helps them, let them know that you are interested in them and you're invested. You're willing to spend time with them. We're talked about this. Okay, so moving on to chronic illnesses. So a chronic illness is long lasting or reoccurring, right? So some people might have an illness that affects them every day. Some people might have an illness that kind of flares up from time to time. Those are both chronic illnesses, or both types. The disability is going to vary. Some people might be very impacted by their chronic illness. Even the same chronic illness. Maybe somebody has asthma or COPD, something affecting their lungs. One person might only really be affected maybe in the summer times when we have the fires that are going on, the air quality is really bad. Well, another person might struggle with their breathing every day. So the how it affects them can vary a lot, person to person, or from different diseases. Chronic diseases self-management program. That's a mouthful. But what we like to see is people that have chronic diseases, how can they self-manage? They're not going to be able to do it on their own, but we're going to be able, hopefully, to give them the skills and the knowledge they need so that they can manage that disease at home. My son has type 1 diabetes. And so even though he's a youth, he's not old, he does have a chronic disease. And part of our care plan for him is just knowing, hey, right now there is no cure for diabetes. So we're going to help you to self-manage. And actually part of his nursing care program, when we go in to see his doctor for this, is they start developing, okay, he's 16 now. They're like, all right, in 2 years, you turn 18 and you're considered an adult. So we're going to start doing some of these transition plans. And they looked at them and they said, do you know how to fill your prescription? I'm like, what? But it's looking forward and saying, okay, we want you to be able to self-manage. You have the skills and knowledge to manage your disease. So we're going to look at our patients, just like they looked at my son and say, okay, what do they need to know? What do they need to have so that they can manage their chronic diseases? Self-management resource is a website that we could send patients to. That's pretty broad. Usually depending on the disease process, we'll have more specific resources that we can give them. Influences on chronic illness. So if somebody has a older adult with a disease, it's usually going to limit their lifespan. So they're going to live longer, the healthier we can keep them. Family caregivers. So a lot of times we see adult caregivers caring for their parents, if that makes sense. So sometimes we have a family unit living at a home where the adults are taking care of their kids. They're also taking care of their parents as well. You want to recognize what you have. You also have spouses. That's one thing that is really tricky when we're looking at older adults, because as that older adult is declining in function, is their spouse also declining? My mother-in-law is getting ready to have hip surgery. Her husband is 10 years older than she is and has some dementia. So the whole family has some concerns about, after the surgery, is my father-in-law going to be able to take care of her, right? So the family's kind of coming around and we're supporting her to make sure that she has appropriate care. So we like to talk a little bit about nursing diagnoses. Have you guys started talking about nursing diagnoses in some of your other classes yet? So you have your medical diagnosis. So like we talked about asthma. Asthma is a medical diagnosis. You have nursing diagnosis that's not a medical diagnosis, but it's kind of about what might the patient affect and have. So frail elderly syndrome is a nursing diagnosis that we have with our elderly adults. Doesn't mean that it's dementia or hypertension or any of these other issues the person might have, but they might actually develop what's called frail elderly syndrome. And that's just where somebody is older, they're not very strong. They might have an issue doing the things they might need to do. And so we'll go more into nursing diagnosis, but we're going to get you guys more familiar with that because that's what we interact with, what we deal with. We're going to start looking at things called nursing care plans. And we look at care plans, we actually look at our nursing diagnoses. Like it's related to the medical diagnosis in a different way. Okay, we're not going to get too much into it because we'll just go crazy. Effects of chronic illness. So their daily living pattern is going to be altered. You're going to have people that for all their life, they wake up, they make their toast, they go for a walk, they go to work, they do whatever. And as they get older and as they have illnesses, that's going to be disruptive and that's going to be tough. So we want to help them develop some new routines. What could they, if they're a person who loves that routine, okay, how do we alter that routine or fit it so you still have that? So when we're giving care to a patient who's chronically ill, what actions do we want to take? It's kind of fun to see what everybody else answers, right? All right, yes. Almost everybody got this correct. So yes, we want to empower the patient and their families. We want to give them dignity. So this is an example of where provide dignity is a very short answer. When we talk about test taking strategies, it's a very short answer compared to the rest of them. But we knew that's correct, so we chose it, right? We want to reinforce teaching and show respect. We don't want to make decisions for them. And we don't want to exclude the family. A lot of times a family, that unit, they're the ones that are taking care of the patient, that are helping them at home. So we do want to include them. So chronic sorrow, that's something that our patients might deal with a chronic illness. It's this permanent sadness that sometimes people might have as a result of a chronic condition. A lot of times we might lose some of their abilities, some of their things they were able to do. They might not be able to participate in some of the activities they enjoy. And now they have sorrow. So nursing diagnosis, chronic sorrow. This is a good example where a medical diagnosis might be depression. Nursing diagnosis could be, hey, related to this chronic sorrow, which is related to their depression that they have. And we would plan activities or things to help them with that. Spirituality. It's important that we look at spirituality when we're talking about, well, everybody, but when we're looking at older adults specifically, a lot of times it can be used for coping and help provide hope and peace. Especially when we look at the Erickson's developmental stage, right? Like, why am I here? Is this worth anything? Spirituality can be very impactful on people. Some of the nursing diagnosis impaired religiosity, which is kind of a funny word, readiness for enhanced spiritual well-being or spiritual distress. Powerlessness. That's something people often will feel as part of chronic illness and aging. Do they have control over anything? You know, and they might not feel like they do. And it's important that we can help our patients understand, you know, you might not have control over a lot, but there are some things. Yeah, go ahead.
The last slide. What is it? Us trying to listen to what they're believing or.
Right, but not us telling them what we want them to believe, but just saying, you know, like where, like, and sometimes, you know, and it's tough because we all have our own beliefs, right? Regardless of people, if you say you're atheist or agnostic or anything that you are, you still have a belief about that. And so with this, it's trying to be finding out, you know, a lot of times it's more of a crisis of your spirituality. So somebody saying, you know, I don't see, I've heard a lot of people say, I don't understand how God would let this happen. My wife died, now I am sick. My daughter has breast cancer. I don't know how God would let this happen. I don't know if there is God. And so that would be a spiritual distress, right? After this story, I don't understand, like I believe this whole thing my whole life, and all of a sudden I just don't know. I don't know.
And so really, our role as nurses, it's kind of like that patient that was saying, everybody's died, I have nobody around me, like, what do I live for? It's sitting there and listening to them, talking to them. A lot of times patients just want somebody who's gonna come down and just say, that sounds really hard. I'd love to hear more about what you said. You know, they just want somebody to hear them, to be able to process, know somebody cares. This is another great one that's like, would you like to talk to a chaplain? A chaplain might be more qualified to talk about some of the spiritual matters than I am. And honestly, sometimes they have more time. As nurses, we get very, there's a lot we have to do. I'm always going to encourage you guys to sit down and talk with your patients. Sometimes the patients want to talk for hours, and that's good. They need it. We might not have that ability, but we do have resources from other people, like our chaplains, who that's what they're there for. They could come in and talk about it. Did I answer your question, Lauren? Yeah, thank you so much for getting clarification. All right, powerlessness. So lack of control, right? There's a lot of times that patients are going to feel powerless. Coping. Coping is the attitude people have towards, or having a positive attitude and feeling motivated to kind of adapt and change. I see coping and powerlessness as kind of opposite ends of the spectrum, right? Because powerlessness, they can't do anything, but coping doesn't mean that it's all better and that they don't have the disease anymore, but they have changed their mental mindset and have some things in place to help make them feel like, no, I do have some control over this. Hope. We want our patients to have hope. If they don't have hope, then we're going to see that powerlessness. We're going to see the depression, the anxiety. We want to make sure we're being realistic, right? If somebody's like, man, I used to run, and now I can't run. I can't even, walk a block without getting short of breath. Well, are we going to like encourage them to try to go like run a 5K or 12K? I don't know. I'm not a runner. Are we going to be able to, are we going to encourage them to do that? No, because it's not a realistic thing. But we can say, what's realistic? You want to be able to walk around the block without getting short of air? Yeah, let's see if we can go. Let's go with that. Let's try to make that something you can do. It's going to enhance their quality of life, and it helps them to adapt. So sexuality, that's something that's really important to talk about as people get older. It's part of their lifelong identity. It doesn't matter what gender you identify as, or that you are, either way, because it affects everybody, your sexuality. Some of the nursing diagnoses we talk about are ineffective sexuality pattern, sexual dysfunction. This is something that can really affect people. Yeah, so I'm just going to move on. So roles, depending on what your role has been in life, right? If we have, I think about my grandpa, his role was that he was the provider and he provided for his family, and that was his role. That's probably why he went and got a job at McDonald's after he retired, because he wanted to still feel like he was a provider of some sort. He had, he was having kind of a hard time adjusting to his retired life, but he found ways to cope. Somebody who's maybe been like my grandma, who was a mother her whole life, all of her kids moved out, and then she was like, what is my role? What am I doing? Well, she went to work at McDonald's and found ways to interact with all these people and welcome them and feed them in a way. And that really was helpful for her. You have to adapt. So when we look at families and caregivers, a lot of times there can be role strain. So, we talk a lot about the patients who are older and they have their children taken care of. So their children are also taking care of their children. And so that's where we see some role strain. Or maybe the husband and wife, the wife is really sick, the husband's taking care of her, but maybe it's too much for him to do, right? Maybe she needs too much care than he alone can provide. That can cause caregiver role strain. We do have, there are things called respite care. So where people can come in and help, they can, have some assistance with that, but that can still be pretty difficult. I don't have more than that. Okay. Anyway, we'll talk more about this because really it does affect patients, when we look at like the husband and wife dynamic. I've seen cases where both the husband and wife went to a nursing home
because the wife just could not be cared for at home. The husband was fine. He could have lived outside the home, but he wanted to be with his wife. And so that was the best solution, so that they had somebody that could take care of the wife at the nursing home and the husband could stay there with her, right? So you want to find solutions that work for the families. So finances can also be a big issue. You know, we talked about retirement. A lot of people don't have the finances to retire. And once they maybe medically have to start working, then that can become a big issue because they can't pay their bills. Can't pay their bills. Are they gonna, if they have to choose between buying their food to eat or their prescription for their medicine? Usually they're gonna get the food to eat because that's the more immediate need. The prescription's gonna fall off and then they're gonna have some other health concerns that aren't taken care of. Health promotion. Everybody needs health promotion. We wanna give people the tools they need so they can manage themselves. They might need some help and guidance along the way. Really, that's our goal, is to make it, to try to get our patients functional where they can kind of like keep on this path themselves. They might need a little guidance of, oh, you know what, I noticed this, let's maybe try this a little bit more. And I think you're really doing a great job of doing this, but maybe we might need a little bit of this. We're gonna guide and direct them, but we want to help them like they're gonna be on their own on that path. That's the goal. So when we're caring for chronic illnesses, I just want to go back. That's a chronic illness, something they're gonna have for their whole life. You have to respect patients' wishes. My father had a friend who had kidney disease, who was on dialysis. And my father's friends decided he did not want to be on dialysis anymore. So it's horrible. My life is not, I'm okay not being with this. Or not doing this anymore. And he chose to stop doing dialysis and eventually passed away from his kidney disease. My father had a really hard time with that because he did not want to respect his wishes. You know, he said, no, if there's anything you can do, you have to do it. But that was that man's choice to not receive dialysis anymore. When we're looking at making those type of decisions, you really want to make sure you're trying to, if we're involved, bring in families, right? Make sure this is a whole family decision, or at least that the family is involved and that they're aware. You want to teach them. If that was our patient and that's what they were saying they wanted to do, one of the first things I would be like, hey, thank you for sharing that with me. Would it be okay if we maybe just talked about what that decision means and just go through and say, hey, if you stop dialysis, this is maybe what you're going to experience. These are some of the things that you're going to feel. This might be what happens to you, and kind of go from there. Make sure that they're actually informed of what their decision means, how that's going to physically affect them. And we also want to give them dignity. Right? We're not going to make fun of them or be like, well, that's just stupid. I want to provide dignity for them. Okay, you know what? This is your choice. You do have control over some of these things. Okay, we talked a lot about nursing diagnoses. Which of these diagnoses are relating to coping issues for chronically ill patients? So select all that apply. Kind of all over a bit. I'm curious. I like it. Ooh. So compromised family coping, disabled coping, infective coping. Gosh, I thought impaired religiosity was one. Let's go back and look. Oh, it is. It's keyed wrong. Okay, sorry guys. If you chose impaired religiosity, you are correct. So sorry about that. Good job choosing the impaired religiosity if you chose it. Effective coping, that's not a correct answer because the nursing diagnosis, it's something that's wrong, right? Something that's not correct. So we say, hey, this is an issue with our patient. We want to fix it. If they have effective coping, that's not a nursing diagnosis, right? Like that's not anything that we need to help them with because they're doing it. Oh, wrong one. Okay, so we're done with this part of the lesson today. I'd like just to do a little bit of reflection. So on a 1 to 5 scale, how do you feel like you understood today's topic? 1 is like nothing at all, hardly anything. 5 is I really understood it. All right, we're grouped up near the top. I feel good. Like I came in maybe not understanding or not feeling as prepared. We're kind of moving more towards understanding. Take a few minutes and look at the person next to you. And I want you to discuss maybe how you feel the lesson went or something that you learned today. All right, let's start bringing it back in. Just quick question. Oh, I didn't do the SBAR activity. I must have deleted that. Let's just skip over it. Or you can answer if you like the questions or the lecture better. I think that's the end of the presentation, actually. Yeah, that's it. So let's go ahead and take a 10-minute break. When we come back, I'm actually going to have you guys break up into some groups. So if you go into Canvas under people in the class, like here's week 2, group 1. I'll keep this up on the screen, but after the 10 minutes, I want you guys to break up and find your group. And I'm going to give you different assignments. Yeah, let's see. It's like so tiny. Can you guys see them all? Okay, I'll see you back at 9:15. Yep, under people. Yeah.
When my eyes are set up on the screen. Your name, no, my name is Paul. Oh, no, that's not me, that's not letters. I already did. Go to bed. I know, but it's like, well, you tried it. Go. Oh, yeah, I hope one. You're sitting it down, yeah. That is my husband's gift to me. Have you seen the complaint? They can all electric Cadillac Escalade has a 35-inch display in the front, all something like that for it. Oh, captain chairs in the back rows, leather interior, TVs and headrest and things. I'm gonna tell you what I'm an SUV, but I'm an SUV. So like say, well, to turn. Like my husband likes to go to the car. He has a it's like you're sitting on the ground. So I like a big Wi-Fi car. I like the Wi-Fi. I don't like how high it's sitting. No, why would you not? I can't wait to move on.
Yeah, of course. So I have the though, and it's just really then we can have and we're starting from yeah. For right now, for today, I don't have to keep and today.
One second, this is recording. I just wanna, is that okay?
Yeah.
Okay.
So, but I was wondering, like, in the future, like, if something like this happens, how do I go about,
Just message me, let me know.
If I was gonna do that today, but I was scared because,
Oh, gosh.
right now we're both like struggling. Like he has a really high fever. I might take him to the ER tomorrow when I come back from that.
Yeah,
And so that's why I was like wondering how does that make.
yeah, just let us know. The people that let me know ahead of time before class, I'll have them like watch the recording.
Okay.
And then we can fill out the TWL. And fill that out. It's just like, if you fill it out, like within a day, it's 10% off. You still can get points for it.
Oh, okay. Well, yeah, that was my question because I was like, I don't know what to do because he was like, well, you can this class. And I don't know how that.
Yeah, just let us know. Family's always first. And
It's been a really rough weekend. This week's already rough now because he's sick too.
Yeah.
And we have childcare for him, but he can't go to childcare if he has a fever. So
Exactly.
that's why I'm like, I don't know what to do.
Yeah, oh gosh, you could take the water.
I know, me too.
And
But
you stay sick too.
well, I've been telling my husband, I've been like dosing on vitamin C because I'm so scared of like flu season.
Yeah.
So, yeah, I think I'm okay, but they're not okay.
Yeah,
Yeah.
okay, yeah.
Yeah.
If you need to leave, please feel free, you can go ahead and go take care.
I'm already here, so I might as well stay. Okay. Yeah.
Okay,
But thank you.
You're welcome.
Yes.
But like I said, I'm here for Cadillac. Here, the only reason I'm exactly. You wake up, you drive, see your, you see me in front of.
Yeah.
Or like.
So I don't type in goal. This is. And I would cry myself next to you.
And between some and. My husband was also on a from the book. Before really making that. And then like, a certain. Yeah, I just want to make sure that, you know, like, they can be. How will I say? Thank you, Sheena.
Some of these are.
Like when you like 40 and it's like those 40.
No, no, he just went yesterday to do stuff and he was like, oh, I'm not even in the class. And I was like, oh, that's right, I totally forgot. And so they didn't reach out to him, so I told him to go like in the peers and talk to him today.
It's just really, they would just dump those students.
I'm not told him, yeah, or anything.
Or
Yeah,
just put them into another class that had.
yeah, yeah, I was,
And particularly, I mean, twice now asking how the students. Like, you know, work that they put in. And the work that they- because I started out
yes.
and- I mean, they were just not to that particular section.
I'm sorry.
Yeah. No, I'm sorry, the rest of them ended up in that class.
Yeah, it does take, because now he's like behind, or he's behind.
I think he had only done the introduction, though, so that won't be that hard to.
No.
But still.
Yeah, so. Okay, if you haven't already, go ahead and get into your groups. You guys need help finding your groups?
Oh, where's your source?
Group 7. 7.
Might see. Oh, make sure you're looking at your week 2 in-class group. Week 2 in-class group. So these people up here. We'll figure it out eventually.
Just right. Look at that.
Okay, do we have the first group anywhere?
Oh, second, great, second, right? No.
Guys.
Seriously. Yeah. All right, who's we looking for? Yeah. Yeah.
Oh, no, this number is 85. If they want. Okay, ours is
Oh, yeah.
Thank you.
Oh, like, got my RBF on. Like,
Okay, everybody found their groups for the most part? Okay, so I want to give you guys instruction. So each of the groups, depending on, I think we're getting there. So the printer didn't print out all my pieces of paper. Those actually did them. So I have to go look. I'm gonna print out more, and in just a minute, I'm gonna put them up on the board here too, so that everybody can see while I print out more, but I wanna get you guys started. So each group number has a, did I have your paper? Yeah, each group number has something. Like if you guys, number, you guys 7, here's 7. So 7 is gonna explain the stack involved making your visit. And A is the next question that you guys are gonna keep. So depending on what group you are, you're gonna have different questions. Yes, I didn't print out, so I'm gonna put it on the board. So I'll read you guys some of the paper and then I'm gonna put out the board. But if I put it on the board, you're just gonna read that and go and read. So just 7. Only 7 or whichever group number you are. So at the end, I'm gonna give you guys about 15 minutes. In that time, I want you to look at the information that's for your group. And then I want you guys to designate 1, 2, 3, however many people to share and present
to the rest of the group. If you don't present this time, I'll ask you to present the next time we do this. I don't think if you're not presenting today, you won't have to present at all. So, let's go ahead. I'm gonna put on the board. If you have questions, let me know. No.
All right.
You answered this question first, like, it's very different to hear that they keep going on. I know everything about the patients, not everybody.
Yeah.
And do you want to take notes on what we do? No, just that I'm listening.
Yeah.
It's like part of
Everything's ready to fill. Yeah.
That's the name.
Let's take about 3 more minutes. And then we'll start sharing.
So there's, there, do you want to do? Either really have a lot of support. You want to share to us that we're gonna present the hospital.
I don't remember what she looks like.
Portable and.
The environment is familiar. There's a need to make the environment.
Sorry, I forgot I have to change this for Laura before I talk to the students about it. Taylor already, and I made the changes there. I told you to. Did you tell her? No, she's, I don't know, she was just on a roll. It's like essentially rewriting some of the and the thing.
So I understand.
I don't know.
I know.
Let's go back. Okay, let's go ahead and bring it in. All right, if you haven't found the answer by now, that's okay. So let's stay in our groups, but I just want to put some ground rules in. Because a lot of times what happens is the first group that presents, they're presenting and everybody else keeps working on finding more answers or working on theirs. And what I'd like us all to do is show respect for other groups, and while they're presenting, I want us to give them our attention. Listen to what they're saying, because they're actually going to be about. So let's go ahead and kind of put our things down. You don't have to close your laptops. I'm not going to police you unless you start talking. If it's not your turn. But let's listen to the groups as they present. Okay. So that's kind of one of the standards for my classes, that when we do group work, we're respectful of the other. Okay. So is there any, you can stay in your spots. You don't have to go, like, stay where you are. Yeah. Would any group like to present first? Okay, you're ready. Okay, so you guys are first, you guys are on deck. And then you guys are third, okay. Oh, do I have to move on? Oh, gosh, I'm a little thing. Thank you so much. Okay, so go ahead and let us know what your topics were, and then tell us about it. Yeah, either way, whatever you're comfortable with.
So describe an acute care for elders unit in hospital.
Excellent, I'm so sorry. Which number are you?
Number one.
Number one. So if you're looking at the sheet, you can follow along with this number one.
So we said that the LPN role is to provide patient-centered care, monitor polypharmacy, so reduce the need for unnecessary medication, promote functional ability, so decrease the length, in order to decrease the length of stay, reduce adverse effects, reduce costs and readmission, create an environment that promotes independence and ambulation, and to help with ADL.
Listen, what are ADLs?
Daily living.
Nice job. Did everybody hear? Okay. Just, I know, like, it's not so comfortable for us all to speak up, but I want to make sure everybody can hear as well. All right, you got a second? Yeah. Okay.
So for skills, we said active listening, communication skills, therapeutic communication,
empathy, flexibility, relationship building, building trust, critical thinking, clinical judgment, and the humanity process. Yeah, those are good skills we're doing these for sure. All right, any questions for anybody about group one? Yeah. Well, not a question for group one, but I would think group one, not group two. No, but what I am gonna do is make a announcement today, and if you would like to, as your group, snap a pic of the answers that you wrote, and then you can put that on the announcement, just to kind of share your responses with everybody, kind of a little bit of just making it a group work that you can look at later. I would not say there's any more work. You literally can just take a picture and upload it onto the. That's okay. That's okay. That's okay. All right, let's see. We had this group was next, right? And what number are you guys? 4. Okay, so number 4, if you want to look at their questions.
All right. Before identify long-term care options, a few of them, community, adult daycare, provide patient with like assistance, supervision, socialization, and for disability, people with dementia, and some of the people that work there, like nurses, aides, nurses, basically they'll be there to help with activity of daily living, and we also have social workers and therapists, and then residential, which is more like a private resident. Owner live with that resident and offer personal care, meal supervision, supportive services.
We wanted to split it up, so I wanted to do it.
I like the we, this is elaborate.
Yes,
right?
it was collaborative, so we decided to split it up. So the third option is community care, which is like, with community care, which is, includes retirement communities, assisted living, communities, and independent living. Assisted living where they live in a facility, they pretty much they can do what they want, but they maybe didn't take their medication or something like that, so you have a nurse there to do those things. And retirement communities are where you have to like 55 and older to live there, you have somebody come to your home and provide that kind of care. Independent living, you live on your own, you know, pretty much self-explanatory. You got residential care, where they live in their own home and you have a nurse come to their home and help them with tasks like medication, cooking their meals, things that help them with the ADL. And then you have institution, which is like nursing homes, hospital care maybe, where it's like full-time observation, ADLs are planned and coordinated psychiatry, medication, and they also offer something that I just heard is called the Greenhouse Project, where they live in houses with like at least 12 residents, and they have like it provides like a home setting where they have like a kitchen and a main, a dining room, and they can sit and come together like almost family oriented, but each resident has its own, they have their own room, their own bathroom, and they get those the assistance that they need with medication and things like that from the nurse in the house.
Yeah, very similar.
Services that can be offered with the most all very different. The level of care that is continuous, but some of them offer rehab and help with the ADLs and sometimes hair salon and movie nights and like all of these other shows and stuff. Or the game night. I know one of the facilities I wanted to do that to decorate, like Halloween and like how to haunted house for them to hold on to. So some people do just focus on interact with each other. Right?
All right, and you guys have volunteered, that's
Yeah.
what number are you?
We were group 5.
5.
Describe the role of the LPN in long-term care setting. The LPN is responsible for patient safety and direct bedside care in nursing homes, and we're always under the supervision of an RN. and the roles include administering medication, supervising, educating, mentoring nursing assistants, providing nursing care, contributing to the care plan, communicating with the healthcare provider, doing rounds, ensuring patient comfort, doing documentation, and reporting concerns to the supervising registrar.
So I had what those would be important. Alright.
Never mind, we'll come back.
Sorry.
But A is, prescribe patient safety intervention for long-term care. Fall prevention is one of them, both by educating them, monitor the patient's cognitive and, cognitive impairment, their balance and, incontinence, modify the environment, for example, removing obstacles or adding assistance tools. And also providing, a good life because the eyes change, and they need like the extra light to see the surroundings. Yeah. Right, those people who come in to check on their well-being, they're not massive, but, they think the users come to, right, either shower it or therapy.
So maybe as they're exiting the long-term care or like a rehab care, can be put in those services.
So I had 5G, what skills is important to, caring for the patient setting? So I said, dressing changes, sanitation, feeding tubes, using it by butcher the name, tracheostomy, using fluoxetine or it's like urostomy, holding the sexual maintenance, patient standard education, monitoring, patient status, and then blood pressure.
Thank you, guys. All right, who's next? Okay, I saw you guys in the far back, then you, and then you. All right?
Okay, so ours was the lower professional nurse.
Okay.
We're from nursery, and then it's a describe the role of the LPN and instruction nursing for the role. We have worked safely, followed healthcare standards, demonstrate professionalism, respond appropriately to situations, screen inmates for HIV, TB, STI, screen inmates for mental health, screening. And then the A is what skills would be important in caring for the people in the settings. And we just named like just a few, which was be aware, be vigilant. And then we said treat inmates as humans and have no bias.
I think that one's really tricky because so correctional nursing, that's either in jail or prison or something like that.
Right.
And so you do have that balance that you have to maintain of being safe and being aware because they're your patients, but you know, they're in jail for something that they have done. But then you also want to treat them as human and be kind and listening. So it's very much a balance of that safety awareness, but also humanizing them and treating them with dignity. That was really good. Okay, then on to, I think, front row.
So we have number 6, which is describe home health care eligibility. And home health care is for those who choose to age at home. It is a more affordable and convenient option to provide care in a community. It is provided to those who require more care after a hospital visit. A provider puts it in order and your insurance has to be compatible with these terms. Being homebound is determined by the RN and is provided to those who require skills
performed by nurses, physical therapists, occupational therapists, and speech therapists.
Yeah, that's good, because it's always important to know like who is eligible for all of these services, right? Like if you go to a hospital, they're required to take you in, but maybe not as a nursing home or a health agency. Like there's a lot of eligibility things that eventually, depending on where you work, you'll start understanding like who is eligible for these types of care. Insurance has a big part of it as well.
So it says explain differences in hospital nursing care versus home health nursing care. When you're in a hospital setting, everything is there for you, ready and available. And it's more of a skilled nursing. And in home health, your home has to be evaluated. And the resources are not always there readily, like in the hospital. Also, it's more comfortable, it's more affordable, and family can be doing the home health versus the nurses at the hospital. And they have to set up their own transportation. Unlike hospital, everything's there. Everybody is there at the hospital. And in home health, your nurses and care team comes to you at your home.
Good differentiation. At the end, I don't remember how to put that. Okay, and then middle here.
Okay, so we had number 7 and explain the steps involved in making a home health care visit. So the first step is preparing for the visit. So you want to develop a plan of action, so you don't just go in there with no purpose. And one of the main points that they talked about was don't give like a specific time, like I'll be there at 7. Give a time range of a few hours just in case something happens and you can't be there exactly when you said. And then the next step is safety consideration. So that comes with like, as a nurse, you need to be safe in where you're going, make sure you have gas and a charge phone. And then it also means like in the house, make sure there's no hazardous areas. And then the next step, infection control. So you have to bring your supplies because you don't have that like a hospital. And one of the main points they pointed out was never wash your hands in someone's kitchen sink. Make sure they go to the bathroom. And then the next step, documentation. So document what you're doing, when you're doing it, how they do with it. And most people have a folder in their house with their information. And then the last step is patient education. So you want to educate the patient and their family because a lot of times their families are their caregivers. And this will improve their health outcomes. And it said in the book to have a 3-ring binder with all the handouts of extra stuff that you can give them to educate them.
That's good. And usually depending what agency you're working for with home health, they'll provide you with those printed like materials. They're like, oh, this person also now has this. You'll have that already provided for you. You can just pull out to give them for education. You won't have to find that yourself necessarily. What am I missing? You guys? We're still more. I'm sorry.
We have a second part.
Yeah, go ahead.
So I explain the safety practices while you're home visit. You want to always make sure your gas tank is filled. You want to make sure your cell phone is fully charged if you have access to Wi-Fi. You want to keep your laptop from hitting all of your general topics. Hit the lines. Make sure you're aware of all your surroundings. Knowing where all the exits are and windows allow you to get out safely. Call your agency if you feel unsafe at any time. That's very key. And then, of course, looking around the home, making sure there isn't any gap. So like cords, tripping over cords, people who in a wheelchair, make sure that all folks. Rugs.
Rugs are one of the biggest hazards for tripping in people's homes. Yeah. Nice job. I'm so sorry to cut you off.
Yeah. Wash your face. Never wash your hands in people's kitchen.
In the kitchen.
So what's the reason for that?
Because the kitchen is where you prepare food.
Mhm.
And so when you're washing your hands, you're either preparing for or just finishing whatever you're there for. So if it's wound care, a lot of wound care happens in home health, or giving IV infusion, sometimes you're giving somebody their antibiotics or whatnot. It's usually, you're washing because you're encountering some sort of biological contaminant. And so you want to keep that separate from the food.
Okay.
So, yeah, that's just kind of a courtesy, respect, and if they tell you, my bathroom's under construction, all we're using is the kitchen sink. Yeah, that's fine, you have to adjust to what you have. It's better to wash it in the kitchen sinks than to not wash it all.
Okay.
But if you have a choice, the bathroom is the better choice. Yeah, good question. Let's see, it's a good two more groups, you guys are ready? All right, and you guys are on deck? Okay.
All right, so we are number 2. We
Oh.
decided to.
That's okay. No, that's okay. I was using baseball terms. Not everybody is baseball fan. Go ahead. You're good.
So we are number 2, on this list, describe the role of the licensed practical nurse and medical officers or clinic. Brief overview, LPNs provide patient care in medical offices and work with patients of all ages. For the rules, I will be discussing those, and then someone else will do the skills. So we talked about the importance of making patients feel comfortable, following HIPAA, obtaining medical and medication history, and also reinforcing teaching for promotion.
That's really good.
Skills, patient care, rehabilitation, have good communication with the patient, and also communication with others. Teaching skills, following the phone, wound care, medication, charting, doing violence,
Thank you. Okay, now I feel like we're good. All right, I just didn't want to cut anybody off again. I feel really bad I cut you guys off. Thank you. Okay, and this is our last group. Everybody else here? Not you guys. Okay. Anybody else? Okay, you guys and then last group.
Okay, and then number 8, identify home thinking and interventions for patient. And we identify, there's piles of stuff in their home. A lot of older people like to have like books and stuff to like papers,
Yeah.
like that. Rugs, like these like a big concern. And then also making sure they have like handles like in the bathroom if they are gonna be living at home and staying at home, they need to be able to like hold on to handles or something one that you can find. And then making sure their beds are like nice and low, not a super giant bed where they have to jump onto their bed. So that's like fall prevention. And then our second part was also to describe methods of infection control. So we would, we talked about like grooming, making sure they're like clean, hygiene, if they have wound, like wound care, making sure that you also have good, like healthy meals, that would also prevent like infections. And then just making sure like their home is clean, as far as like aseptic wise, like there's cleaning and there's like aseptic.
Right. Yeah, and some of that's challenging for the home health nurse. If somebody is not very tidy or there's some cleanliness concerns, sometimes you have to work with what they have about maybe just stressing the importance of having a clean area where they're doing their dressing changes or something like that. So yeah, it's a challenge for sure. That's it. Good. All right, nice job. Okay, last group.
Number 9, question was identifying documentation required for home visit with the patient. So the first thing we require is at arrival and departure time. That's basically like walking in and out as we go with the system as a child. It identifies the time that she came in and basically the timing of the patient. The second one is viral signs. It is useful when it comes to monitoring the risk of problems. You want to know, like, if shape, kind of transplant, maybe that's slowly or. Data collection finding. Maybe since this is a home care visit, you wanna communicate with your provider, know if there are any changes. Maybe they tell you something, like you wanna have information for you actually deal with the patient. Yeah. Description of any procedures performed, you wanna document like what you did with the patient, you can walk them, transfer that, do an eventual open patient education, depending on the patient care, like you wanna document or what you did, what advice you get to the patient, right? Maybe they have an injured knee, if you inform them not to put any pressure on it, maybe depends on the patient condition, right? Patient signature, I always give a patient signature after the end of the visit.
And for A, we have pain nursing interventions for home health care patient and caregiver. We want to encourage the patient to go out of bed and move around, have their walls while figuring out for the day. Make sure the care, like I said, make sure the caregiver provides gals has their everyday activity situated. Make sure we're assertive about the mobility devices. You don't want to fall, and it's like especially about the rug throughout home. And then make sure the patient is on their dietary plan. When eating, make sure the psychological needs are met and recognize the cues to health changes to notify the RN.
Yeah, that's really good. I like that talking about cue changes because, you know, I don't remember which group talked about, there's gonna be usually a binder or folder there in their house that will have notes from the team. And so you might say, gosh, this wasn't what I thought I was gonna encounter here. You can go back and look through those notes and compare that to what you see done with the patient. And that might be a big difference that you need to address with other, like, the nurse, their RN, provider. But, all right, you guys did a really good job of looking into these. Thank you. I think, I always get so close on time. Okay, really quick before we're done, I want to show you guys on Canvas. The individual assignment is next week. And so in Canvas, I've made groups that you all have. And that will give you your body system. Okay.
Yeah.
So this is related to the reading that you're going to do this week. I'll show you where to see which body system is yours, but I have instructions on here. You need to make the initial post following these prompts. And then this is one of those discussion boards that has, you have to have a peer reply, like the introduce yourself discussion board, where you have to reply on at least 2 other responses. And I'm actually going to clarify this a little bit because I want you guys to reply with like what you learned from that, or just a more like a meaningful reply. If you have any questions about exactly what these prompts mean, on the 3 dots, you can show the rubric, and then that shows you exactly what I'm looking for. Like here, what are 3 age-related changes? You know, you get 20 points for correctly identifying those, and then less points as you go on. All right, so that will be this week. Next, if you want to find out what your body system is, I know yours looks a little different than mine, so let me go into student view. This is in your book. This should just come from your book. So if I go to student view, if you go to people and then groups, it's kind of like how you found today. It's kind of weird how it sets it up. Like here you can see, like here was the week 2 groups, but cardiovascular, that's your system. You just hit the little caret or the arrow, and this shows who is assigned to this. Now you're not doing this as a group. I'm just saying these 4 people will research and put their post on cardiovascular individually, not together. It's just, we have more students than we have body system groups. So find which body system you're assigned to, and then make sure to go to that discussion board and answer that question. All right. We're at the end of class. I'm going to make an announcement. And on that announcement, if you don't mind, just snapping a quick pic of your notes today, please don't rewrite them or type them like people. We can all look up this information, but it's just a resource for everybody else. Now, if you don't mind just finishing the L of the KWL, just name 2 things you learned today and then submit that to the assignment in class.
Okay. Can we go through the whole thing again? I promise you, I swear. I didn't. There you go. Like 85.
All right, thank you guys.
No, you said take a picture, no, and then you said fill this out. You saying take a picture. Right, that's what I heard. You want to. Take everything, yeah. My vital senses. I already
No bag. Right.
Yeah, foundation. So next class. Yeah.
I was like, it's slow. Don't judge me, I'm serious.
What are you pretty center?
The notes from today, I'm making an announcement right now.
Your sock. It's in the back of the class.
Back at 11.
Yes, yeah.
Or 11.
Well, 11 because it's Abby's class. Sorry.
Did they lock the door?
Yeah, it's just, it won't be monitored.
That's fine.
Yeah.
It's so.
Yeah, it's totally fine.
Or go to the end, but they're perfecting their.
Yeah. So if you come over here, if you look under,
And I saw that you did message me back, but that wasn't the question that I had.
oh, I'm so sorry. So every time I'm done with a question, it's in the correct order, but it's able to see the pouch. Oh. I don't know if it's like I'm literally, so when I went back to the book and I was looking at it, I read it exactly the same. Yeah, it was still different. Let's look at that. That's why I was like, I'm so frustrated because it was like upside down. Backwards. Yeah. Yeah. I think it's probably easier if I show you this way. So your assignments are worth 20% of your overall grade, but you have all of these quizzes, you have all of these personalized learning, you have all of these other ones. So it's all averaged out. It's not like you get your, because that. No, that's just for tests and then your overall grade, or if we feel like there's an issue in general. No. Yeah, a few people had asked me that as well. And let's go into FA Davis really quick and look at that. Yeah, I'm so sorry. And then, do you have a quick question or I can, or wait, either way? Yeah, okay. Okay, gotcha.
No, we're all.
Okay, we are all important, thank you.
That important. Silly.
You're fine.
Me and insurance.
I'm sorry.
Let's. This one. Okay, Maslow's, okay. From. I see what you're saying. What they want is like the highest priority is at the top.
Right, and that's, so I think that when
Because
I
it's
did
flipped
it-
from what Maslow's would be. So next, if you see a question like that,
So I think that
Foundation
for
lab.
for me, when I put things in order, from highest to lowest. I mean, like, does that make sense?
I see what you're saying,
I
but
find
it's
it all
always gonna
every
have,
single-
highest is gonna be on the top and lowest will be on the bottom.
Yeah, so like the last much thing that we just did.
Yeah.
I know that's why, because of that.
Gotcha. Okay, so no, going forward, because especially because there'll be test questions that might.
I
you
know,
order it.
I know.
So always, highest is always gonna be on top.
Okay.
It's confusing because I can see how like Maslow's is built
Yeah, I even compared
in that way.
just to make sure, I was like, what?
Yeah, but when they're asking you to say from highest to lowest priority, they're wanting the highest to be at the top and then on down. Yeah, I'm sorry.
No, but that's.
Yeah, I'm glad that we looked at it. All right, hope your family feels better.
Oh, yeah, thanks.
Yeah.
I don't even know. No joke.
No, I'm gonna go in there. And I think like number 4.
Okay.
Let me check and see.
Because we have. Yeah. So would be the 14th, and when do you get back on the 16th? Let's see, I have to run through any test. Are you out of town? No. Oh, gosh, okay. All right, I will check and see what the director knows. Okay, cool. All right, and then the 14th is.
I think, well, Friday night, I'm gonna go to California, but like I know that.
Gotcha. Okay, I'll see. I mean, it might even, if she lets you, it would probably the 13th. So I'll check. Okay, cool. All right, thank you, Courtney.
I'm sorry. I saw like, this is one, test one. And 16, yeah, okay, so is it everything that was over now, or can you sort it out?
Yep, next week I'll give you guys a study guide. Okay. You'll have that to look at, and so if it's not next week, it's the week after that. I'll give you a study. Homework and stuff.
Okay, all right, okay.
Yeah, good question.
Sorry, I forgot to submit this assignment because could not pay attention for the meeting. Is that okay?
No, yes, you need to commit it, but I can't commit it. Because if it's submitted after due, those are policy for
Yeah,
nursing.
this I could, like, I think he put it 11:59, so that's why.
Oh,
That was the only reason, otherwise I was ready, yesterday evening.
I'm so sorry. Yeah, all of the assignments for the most part for this class will be due Monday, just like morning, 8 o'clock, except for the discussion board, because you have to reply to appeal. Yeah, I'm so sorry. Yeah, I'll look at it. You're required to do all the assignments. I just can't use the credit. So, but it goes into the assignment category, so assignments overall are 20% of your grade, and that's not one assignment. So, will it decrease your grade? No. If you do well on the other assignments, you won't have a picture. Yeah, you're welcome, I'm sorry.
Wow.
And I keep getting into this.
With Terry?
Yes.
Deep breath.
Maybe I'll get this thing, let's go for another day. That's for the day.